Strathmore-Brooks, followed by Manning.
Thank you, Mr. Speaker. This government has gone to great lengths and spent a lot of taxpayers' dollars telling Albertans that generic drug prices would be coming down. However, a pharmacist in my constituency recently had to inform one of her patients that he now has to pay more than double what he used to for his morphine. Previously, he paid about $68. Now he's paying $155. In her email to me, she said, quote, "He was so upset and I felt like crying." To the Health Minister, how many more stories like this do you need to hear before you realize that your centralized Medicare program is a total failure?
Speaker, on behalf of the Minister, and the Minister has made it very, very clear that the health system in this province is going to be and is and will remain publicly funded. We need to make sure that, for now and for in the future, that our publicly funded system is operated properly in the most efficient way. I think the Pharmacare program is one of those programs very, very clearly laid out by the Minister that we are going to have an opportunity for all Albertans to have a great program going forward where those that are in most need will get the best benefit.
Honourable member.
Thanks, Mr. Speaker. Not quite sure where that was going, but given that morphine patients don't have the luxury of choosing to go off their medication, and given that this patient in particular just can't afford such a drastic increase to his medication, how can this minister look at Albertans square in the eye and say his centralized Medicare program is good medicine?
Mr. Speaker, I stand by the comments that I made, and if there's any individual concerns that the member wants to bring forward, not in this assembly but to the minister's office, I'm sure that the minister will handle that in a timely fashion.
Honourable member.
Doesn't seem to ever return my calls, but given that when this pharmacist told her patient of the increased price, the first words out of his mouth were, "But I thought drug prices were going down." Will the health minister immediately apologize to this patient and all Albertans for this misleading advertising campaign and admit that his centralized Medicare program for generic drugs has completely backfired?
Mr. Speaker, I find it ironic about these situations that occur right now. The program starts to kick in later on this year. The new generic pricing will kick in May 1st. We haven't even got to where the member is talking about. But again, if the member has specific concerns that he wants to bring for a constituent, he can bring them to me. He can bring them to the health minister's office, and I make a commitment to you that we will help you out.